Brent, good to see you. Let's talk about Medicare basics and misconceptions. There are many different enrollment periods with Medicare, and there are penalties, of course, if you miss your enrollment period. October 15th begins annual election period that runs through December 7th. But first question, when are we eligible for Medicare? When do we need to enroll? What's the deadline we need to keep in mind?
Absolutely. So essentially, when you turn 65, that's when you're supposed to enroll for Medicare. Okay. But it always reverts back to the first day of the month. So even if you're born on the 20th, whatever is the first day of your month of birth, that's when you should enroll. Common misconception is, Brent, I have to enroll at 65. That's not actually accurate. If you're still working, it's a completely different conversation. You can keep on that coverage if you want to. And then also you can make changes during that annual enrollment period that you just discussed. And that's for things like Medicare Advantage, Part D plans, stuff like that.
Okay, so let's jump into the weeds here now. There are four parts to Medicare, A, B, C, D. Let's talk through parts A and B first. What do we need to know?
Sure. So traditional Medicare is actually parts A and parts B. Part A is going to be your hospital. So the semi-private room, regular meals, medications, all the things when you have that hospital visit. So part B is going to be where you actually do pay a premium. It's around 170-ish a month. And that's going to cover all of the doctor visits, the outpatient care, home health, and stuff like that. What's important to keep in mind is with original Medicare, that part A and B I was talking about, no dental, no vision, no prescription drugs, no long-term care coverage.
Mm-hmm. Okay, so then let's hop over to part D, because this is how I remember it, part D for drugs, right?
Correct. That is the easiest way to remember it. It was added in the 90s by, I think, President Bush. This is going to cover all your prescriptions. And so in my opinion, this is always the wild card of Medicare. I can very, very easily figure out what a client should expect to pay for traditional Medicare. Part B has always been Part D has always been the wild card because if you're taking a name brand medication, your costs can get pretty high.
Okay, so now let's hop over to part C. Some say you need it, the Advantage plan, others say you don't.
Yeah, so Medicare Advantage is essentially the government's contracting with insurance companies and they're administering your care. So by the insurance company receiving money from the government, the big benefit of Medicare Advantage is there's usually no premium, but you're normally going to be required to use a certain network. You can't just pick any doctor you want to use, and then you're going to have out-of-pocket costs, high out-of-pocket maximum, deductibles, co-insurance, all those little nickel and dime fees that can add up.
Okay, so what is the primary difference between using a Medicare supplement and a Medicare Advantage plan?
Yes, very glad you brought that up because I almost always recommend a Medicare supplement. So I
Okay.
kind of just talked about Medicare Advantage. We know that you're going to have to stick to a specific network usually, and then you're going to have the nickel and dime costs. I love the Medicare supplement because the easiest way to explain it is Medicare A and B cover 80% of your costs. Your Medicare supplement covers the other 20%. You are only on the hook for a roughly $200 Part B deductible per year. The other reason I love the Medicare supplement is there's no network restrictions. So if Medicare is accepted by the doctor, they have to accept the Medicare supplement. This is great for travelers. This is great all around. And so
Right.
that's one of the main reasons I recommend that.
Okay.
The downside, as there is with everything, is there is a monthly premium, and it's usually about 125 to 150 a month.
Okay. Well, clearly, Brent, a lot of moving parts with this. How do you even begin to figure out what a client needs?
So we sit down, and the first thing I do is I explain what they actually need to know. Because the second you turn 64, you're going to receive so much junk mail. It is unbelievable. And maybe 1% of it is actually information. Most of it is marketing. So I sit down and I explain what the various pieces are. I say, this is the information you need. This is my recommendation. We talk pros and cons, and then we go from there.
Okay. So if somebody would like to talk this through with you, Brent, what's the best way to reach you?
Yep, they can call the office 614-430-8383 or young-wm.com. We would love to talk about it. It's a very important piece of retirement.
It is. All right, Brent, thank you.
Thank you.